Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
This is Dr. Amit Singhal. I am an ENT and head and neck surgeon. I am doing my private practice at my own center in Mathura, Uttar Pradesh. I mainly practice in ENT and head and neck surgery. Today's topic, understanding vertigo, why it happens and what it means. जो सबसे पहला सवाल आता है कि क्या है चक्कर आना, वर्टाइगो क्यों होता है और उसका मतलब क्या होता है। तो एक सिंपल सा सवाल होता है, जो एक पेशेंट आता है वो बोलता है डॉक्टर साहब मेरे को चक्कर आ रहा है। तो आप सबसे पहले पूछते हो, हैव यू एवर टर्न्ड इन बेड, लुक्ड अप सडनली और स्टूड अप एंड फेल्ट लाइक द होल रूम वाज स्पिनिंग। पेशेंट बोलता है यस, दैट स्पिनिंग फीलिंग इज ऑफन कॉल्ड अ वर्टाइगो। And many people can be confusing because vertigo is very confusing, frightening also, and deeply unsettling because a vertigo patient is always comes in a ENT OPD very much frightening attitude। डॉक्टर साहब मेरे को क्या हो गया है, मैं चक्कर ही चक्कर आ रहे हैं, मैं ना कुछ खा पा रहा हूँ, ना लेट पा रहा हूँ ढंग से, ना मैं सर घुमा पा रहा हूँ, ना चल पा रहा हूँ। तो एक बिल्कुल फ्राइटेंड पेशेंट आता है। So today, let us understand vertigo in simple words and what it is, why it happens, and what your body may be trying to tell you. First, once the most important point regarding vertigo is it is not a disease by itself. It is a symptom. Means in simple terms, it is a false feeling that you or the world around you is moving even when everything is actually still. People describe it as spinning, others describe it as swaying, tilting, or feeling pulled to one side. It may also come with nausea, sweating, unsteadiness, or sudden fear and anxiety because your sense of balance no longer feels normal. So, how does the body normally keeps us balanced? First, let us understand how our body is keeping us balanced. Your balance depends on three systems working together: your inner ear, senses movement and position; your eyes tells your brain that what is happening around you; and your muscles and joints tell your brain where your body is in space। Means हमारे को बैलेंस में, नॉर्मल बैलेंस में मेंटेन करने के लिए हमारे तीन मुख्य अंग हैं। सबसे पहले तो अंदर वाला कान, इनर ईयर, जो मूवमेंट और पोजीशन को सेंस करता है। दूसरा हमारी आईज, जो देखती हैं कि हमारे आसपास क्या हो रहा है और देख के ब्रेन को सिग्नल करती है। और तीसरा मसल्स एंड जॉइंट, हमारी जो स्पेस में बॉडी है कहाँ लाए कर रही है उसको सिग्नल ब्रेन को देती है। अब इन तीनों में से योर ब्रेन ब्लेंड्स ऑल ऑफ दीज सिग्नल्स टुगेदर every second so you can stand, walk, turn and move safely। मीन्स ये तीनों सिग्नल्स को वो मिला के एक पोजीशन बनाती है हमारा ब्रेन। व्हेन द सिग्नल्स मैच यू फील स्टेडी। अगर सारे सिग्नल्स एक दूसरे से मैच खा रहे हैं तो आप बिल्कुल सही है, और मैच नहीं करते हैं द ब्रेन गेट्स कंफ्यूज एंड दैट कंफ्यूजन कैन लीड टू vertigo। In many people, the problem starts in the inner ear. The most common site of vertigo, inner ear. Inside the inner ear are tiny balance organs filled with fluid and delicate sensory cells. The semicircular canals that detect turning movements of the head. The atrial and saccule help detect straight line movement and gravity. When this system sends the wrong message or when the message does not match what your eyes and body are sensing, the brain may wrongly think that movement is happening। That false message creates the spinning feeling of vertigo। मीन सिंपल, हमारे जो सेंसरी ऑर्गन है बैलेंस का इनर ईयर में, अगर उसमें कोई भी दिक्कत हो, चाहे वो एट्रिकल हो, सेक्यूल में हो, सेमीसर्कुलर कैनाल्स में हो, सबका काम अलग अलग है सेंसरी सेल्स का, तो उससे ये दिक्कत बनती है। दिस मिसमैच कैन ऑल्सो कॉज nausea, vomiting, unsteadiness, abnormal eye movement। So if vertigo has ever made you feel frightened or helpless, please remember this: it is a real physical symptom, it is not a imagined, and it should not be dismissed। Means it should be taken seriously। One of the most common causes of vertigo is benign paroxysmal positional vertigo, BPPV। The name sounds complicated, but the idea is simple. Tiny crystals in the inner ear can move out of place. When this happens, rolling over and bending down or looking up can trigger sudden spinning। Means जो टाइनी क्रिस्टल्स होते हैं हमारे इनर ईयर में, सेमिसर्कुलर कैनाल्स में, जब वो अपनी जगह से मूव करते हैं तो उनका जो मूवमेंट है उसकी वजह से पे रोल ओवर कर रहे हैं, आगे झुक रहे हैं या फिर ऊपर देख रहे हैं, तो उसकी वजह से उनके मूवमेंट से स्पिनिंग सेंसेशन जनरेट होती है। But the good news is this type of vertigo is common and often treatable. The second most common cause and the other cause is vestibular neuritis. The third cause is Meniere's disease. Vestibular neuritis happens when nerve gets inflamed, often after a viral illness. The result can be sudden, severe vertigo, nausea, vomiting, and trouble walking steadily. The third cause is the Meniere's disease. This is a condition which is the change in fluid balance inside the inner ear, which happens because of the change in the fluid balance inside the inner ear, which can interfere with normal hearing and balance of the signals. Along with vertigo, a person may also notice ringing in the ears, hearing loss, and a feeling of fullness or pressure in one ear. This is the triad of Meniere's disease, the tinnitus, the vertigo, and the sensorineural hearing loss with sense of feeling fullness or pressure in one ear. It is also important to know that not all vertigo comes from here. Sometimes it can be related to brain, for example, migraine, multiple sclerosis, or in some cases, stroke. That is why vertigo should not be ignored if it comes with warning signals like double vision, slurred speech, facial weakness, numbness, trouble walking, or a sudden severe headache. In those situations, urgent medical attention is very important. These are the warning signs related to brain related vertigo. The good news is always that many causes of vertigo can be treated. Some people's improve with simple head positioning maneuvers, especially in BPPV. Others need medications, balanced exercises, or treatment for underlying cause. So today's key message of this podcast is to remember vertigo happens when the body's balance signals become mixed up and the brain senses movement that is not really there. Okay, if you or someone you know is having repeated spinning episodes, falls, hearing changes, or severe symptoms, please do not ignore it. With the right evaluation, the cause can often be understood and the treatment can help bring confidence and balance back. Thank you.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.